Hi, Joan.
Hi, Harriet.
So glad you could be with us today. Today I have a special guest, and I'd like to introduce myself and my guest. I'm Harriet Levy, CEO of the Center for Enriched Living, and Joan is president of the center's board of directors. In her professional life, Joan is senior director, scientific affairs at Lundbeck. She is also distinguished as an infectious diseases pharmacist. And today we're having a conversation about the COVID vaccine and its impact and efficacy on our ability to continue with the reopening of CEL. Joan, thanks so much for being with us today. And tell us more. How can you inform us more about the COVID vaccine?
Well, I first want to start off by saying that right now there are currently 10 COVID vaccines that are available. However, only 2 of these vaccines have received approval by the FDA for emergency use authorization. So these 2 vaccines are, of course, the Pfizer vaccine and the Moderna vaccine, which we know individuals receiving this vaccine, either one of them have to receive 2 doses for it to be the most efficacious. So let's talk a little bit about the emergency use authorization, because I do want to make it very clear that this is not a shortcut to get the vaccines out there in the public domain. This is actually a very robust process by the FDA in order to help facilitate the ability and the use of medicines and vaccines during public health emergencies such as the COVID-19 pandemic, when there's really no other options available for us. So what the FDA does during this emergency use authorization is they utilize the data that's currently available from the clinical trials to really scrutinize and analyze the data from a safety and efficacy standpoint. And I just want to note also that these COVID-19 vaccinations are being held to the same safety standards as all other vaccines that have already been FDA approved. So what the FDA did is they looked at a total of 8 weeks of safety data after clinical trial participants received the second dose of the medication or the vaccination. And the reason why they use this 8-week benchmark is that it's highly unusual for side effects to appear more than 8 weeks after the second dose of the vaccination. Not only that, there was a very large number of participants in each of these clinical trials for Moderna and Pfizer. With Moderna, there was around 30,000 participants enrolled in their vaccine clinical trial. And with Pfizer, there were over 45,000 patients enrolled in their vaccination study. And what they determined is that from this large group of patients, there were really no significant safety concerns identified. And do want to make the disclaimer, they did find a very small number of severe allergic reactions. But the benefit definitely outweighs the risk of the allergy, since this was such a small pool of patients that did get the allergic reaction. So when you do go to get the vaccination, you might be asked to stick around for about 5 to 10 minutes, just so the healthcare providers there will can ensure, by observation, just make sure that you don't get the allergic reaction or don't have any kind of allergic reaction to the vaccine. The other thing I want to point out is that these are messenger RNA vaccinations that do not use the live virus that causes COVID-19. So these vaccines can't give you COVID-19. The other point to note is that these vaccinations do not affect or interact with our DNA in any way.
So good to know. And thank you so much for clarifying the confusion so many of us have about the COVID vaccine. Is there anything else you could share with us to encourage more people or all who are eligible to get the COVID vaccine?
Yeah, I think one of the main things I want to articulate is that over the course of the year, there's a lot we've learned about the COVID infection. First and foremost, we know that if you get infected with COVID-19, there's really a range of illnesses from very mild symptoms to severe illness to even death. What we also know is that there's some people, some populations that are more likely to become severely ill. So those include older adults greater than 65 years of age, and then people with certain pre-existing medical conditions. But what we don't know about the COVID infection is how it's going to affect each person individually. In other words, just because you're under the age of 65 or just because you don't have any of these underlying medical conditions, this doesn't guarantee that you're only going to have a very, very mild course of disease. And that's why it's so important to get the vaccination, because this will really help create an immune response in your body so that if you do get exposed to the virus, you can effectively fight it. So this will in turn potentially help you from getting very severely ill. And what's more important, this may even protect your family, your coworkers, and the CEL members that you interact with on a routine basis.
Yeah, and that's really why we're having this conversation. We want the center to be fully opened as soon as possible. And I think that's going to happen when all of us who are eligible will be able to get the vaccine and tamper down those numbers and get rid of this pandemic. So anything else you want to add?
No, feel free to contact me if you have any questions, any reservations about the vaccination. Happy to talk it through with you one-on-one. So I'm available anytime.
Thanks so much, Joan. And to our listening audience, we so look forward to the day that we can all gather at the center, and we'll be able to do that once we all get the vaccination. And until then, in addition to the vaccination, continue to follow the CDC guidelines of social distancing, hand washing, and wearing your mask. And thank you so much for listening to this message today. Thank you, Joan. Thank you for being here.
My pleasure.